Hi, my name is Sandra Conran and I'm a physical therapist at the Reston Office of Bodies in Motion Physical Therapy, and I am certified in the Meeks method approach to osteoporosis and posture management. Have you lost more than 1 to 1.5 inches in your best postural height? This is considered statistically significant, particularly in those with osteoporosis or osteopenia. Do you need more than one pillow at night for neck comfort? Do you have at least a 2-finger space between the lowest rib and the top of your pelvis? These are all signs of postural change associated less with normal aging than with weakness of the spinal muscles and poor postural habits. One misconception is that these changes are inevitable if you have osteoporosis. The good news is that these changes can be arrested and in some cases reversed. The first portion of postural change that I'd like to talk about is a forward head. That is when more than 1.5 centimeters is between the back of your head and a wall when you stand up against the wall. A forward head can lead to symptoms such as headaches, decreased mobility of the neck, pain in the neck, decreased lung capacity, and I even have a funny picture of text necking. The second postural change is thoracic kyphosis, old-fashioned name of a dowager's hump or a rounded upper mid-back. In this position, the joint forces are up to 67% higher than they are in an upright posture. Osteoporosis tends to show up in this portion of the spine first, and it increases the likelihood of compression fractures. Decreased strength in the mid-back and between the shoulder blades results in this posture, and along with tightness of the chest wall. Lumbar lordosis is a sway back. Someone's standing like this. The pelvis is tilted forward. This can be a source of low back pain. Typically, the muscles of the back corner of the hips are not engaged. We're hanging on the hip ligaments, and we often feel tight in our thigh muscles because the hip muscles are not well engaged. The opposite is when the low back is excessively flat and tilted backwards. This can be a position of relief and appropriate for short term for people with stenosis. When people are exaggerated kyphosis in the thoracic spine, we often see that accompanied by a loss of lumbar lordosis in their back. Sometimes these changes are bony, as in spinal compression fractures from osteoporosis, but often they are due to weakness in the spinal extensor muscles, those that fight gravity and keep you upright against the world. This is a good point to tell you. It's inadvisable to try to walk around in a military posture. If you walk around excessively upright, you will strain muscles that are not used to it. Physical therapy using the Meeks method of isometrics to improve strength in the spinal, hip, and shoulder girdle muscles is SAFE, an acronym meaning Safe Activity for Everyone. Developed for those with osteoporosis, it works well with anyone experiencing the postural changes we have discussed, as well as those with fibromyalgia and other chronic pain conditions. With the Meeks method, you can learn safe patterns of movement and safe postural corrective exercises. Don't let gravity win. Thanks for watching. Be sure to check out our channel for videos on other physical therapy topics. If you haven't subscribed yet, please subscribe. And if you enjoyed this video, please hit the like button, leave a comment, and share it with others.